Hi, hello, welcome back to my channel. Let us see. Question number 1. The day after an amputation, the client begins to hemorrhage from his stump. What action should the nurse take first? Option A. Apply a pressure dressing to the stump. Option B. Place a tourniquet above the stump. Option C. Notify the physician. And option D. Apply an ice pack to the stump. Answer. Question number B. Place a tourniquet above the stump is correct answer. Question number 2. A 72 years old male client has a total hip replacement for long standing degenerative bone disease of the hip. When assessing the client post operatively, the nurse considers that the most common complication of hip surgery is option A pneumonia, option B hemorrhage, option C wound infection, option D pulmonary embolism. Option D pulmonary embolism is correct answer. Question number 3. The nurse is caring for a client who had a right below the knee amputation 3 days ago. The client complains of pain in the right foot and asking for pain medication. What nursing action is appropriately initially? Option A. Elevate the stump. Option B. Administer a placebo. Option C. Administer ordered medications. Option D. Encourage the client to discuss his feeling. Option C is correct answer. Question number 4. During the assessment of an injury for a possible fracture, which of the following manifestations would make you suspicious that fracture has occurred? Option A. Impaired sensation. Option B. Hotness. Option C. Loss of function. Option D. Pointed tenderness. Loss of function is correct answer. Question number 5. A client who has had an above knee amputation developed a dime-sized bright red spot on the dressing after 45 minutes in the post anesthesia recovery unit. The nurse should option A. Elevate the stump. Option B. Reinforce the dressing. Option C. Call the surgeon. Option D. Draw a mark around the site. Option D is correct answer. Question number 6. How you will interfere to relieve the swelling of the lower extremity in a cast for 3 days now? Option A. Change the cast. Option D. Call the doctor. Option C. Elevate the extremities. Option D. Give massage. Option C. Elevate the extremities is correct answer. Question number 7. The nurse is developing a bowel retraining plan for a client with multiple sclerosis. Which measure is likely to be least helpful to the client? Option A. Limiting fluid intake to 1000 ml per hour. Option B. Providing high roughage diet. Option C. Elevate the toilet seat for easy access. Option D. Establishing a regular schedule for toileting. Option A. Limiting fluid intake to 1000 ml per day is correct answer. Question number 8. A diabetic patient with foot gangrene undergone above knee amputation. While the nurse is changing the dressing, he complains of pain on the same knee which was amputated. What should the nurse do? Option A. Inform the physician about it. Option B. Redo dressing to assess the wound. Option C, psychiatric consultation to the patient because he wound above knee. Option D, give analgesics as needed. Give analgesic as needed is the correct answer. Question number 9. A diabetic patient with foot gangrene undergone above knee amputation. He complains of pain and swelling at the wound site, which oozing pus and as a bad odor. The physician ordered cephalexin and metronidazole. Which of the following you should do immediately? Option A, give cephalexin direct first action. Option B, give metronidazole direct first action. Option C, do wash on wound with normal saline and put bacitracin. Option D, do wash on wound with normal saline and put hydrocortisone. Option C is correct answer. Question number 10. The physician has prescribed a cleansing enema to the patient or to a client scheduled for the colon surgery. The nurse should place the client in option A, prone position, option B, supine position, option C, left sims or left lateral position, option D, dorsal ligament position. Option C, left lateral position is correct answer. Thank you. Please subscribe and share the video.